Now, moving on, the government has kicked off a fumigation exercise of all government offices and compounds following an upsurge in COVID-19 cases. This comes as Kilifi County Assembly General Oversight Committee rejected a report by the executive detailing the expenditure of 220 million shillings towards the fight against the pandemic.
Garissa County Commissioner Meru Mwangi said among the offices that have been fumigated are the Regional Commissioner's Office block, the County Commissioner's Office compound, which also houses most of the national government offices. Mwangi said that also targeted are 2 prisons in Garissa Town and Garissa Police Station that houses the regional and county police and CID commanders.
I am calling upon the Garissa fraternity to ensure that the Ministry of Health protocols must be adhered to, because this is the only way to get rid of the disease.
In the meantime, Kilifi County Assembly General Oversight Committee has dismissed as shallow a 2-page interim report on payments made from the Kilifi County Emergency Fund. In a meeting convened in the County Assembly chambers, it emerged that the County Assembly paid 10 million shillings for the supply and delivery of bar soaps, 46.1 million for supply and delivery of 7 ventilators, 23.7 million for assorted non-pharmaceutical items, among other items.
Our issues really as an assembly is to be able to explain to the electorate, for example, if the county government says it bought 7 ICU beds, where are these ICU beds? How much were they bought? How were they supplied? And so on and so forth. If they say they bought 100 beds, these beds definitely went to the facilities within the county. We have asked them to give us details, which facilities, where can this bed be found, so that the Committee on Health can be able to visit to be able to be satisfied.
Elsewhere, over 1,400 vulnerable families in Kware Slum, Gataka, and some parts of Ongata-Rongai in Kajiado North Sub-County are struggling to support their families due to the effects of COVID-19 pandemic. A spot check in Kware slums reveals that the locals, who mostly depended on casual labor, can hardly afford a meal during this period. Faith Wangai, a social worker and well-wishers, launched a door-to-door campaign targeting vulnerable families in Kaimurunya ward to support needy families during this period of the pandemic.
We've been working with our community volunteers who go door to door looking for the most vulnerable families, and we have been able to outreach to most of them.
And Turkana County Deputy Governor Peter Lotethro has called on residents to adhere to government health directives at a time when the county has recorded an increase in the COVID-19 positive cases. He said the most affected are travelers, refugees and truck drivers.
Wewe sasa kama mwananchi wa kawaida, jukumu ni lako. The Ministry of Health has given you the guidelines. Osha makono, kaa kando na watu, sanitize, fanya haya yote ambao wanasema. Lakini ni wewe mwenyewe ndio unatakana pamoja na familia yako kuhakikisha ya kwamba hii ugonjwa haidhuru familia yako na wengine wote.
Meanwhile, following increased cases of early pregnancies amongst schoolgirls, Migori County Woman Representative Dr. Pamela Odhiambo has launched a program to distribute sanitary pads to all primary schools in Migori County.
There is a crisis since the COVID happened. The number of girls who have turned out to be expectant or pregnant, courtesy of their stay at home, is alarming in this county. We want our girls to remain intact even during this COVID-19, so that we are able to take them back to school and help them to finish their education.
Beatrice Gatonyengetich, Channel 1 News.